Tell us a little bit about your leadership, your management team. How capable are they of making some kind of change in order to go along if you do this?
Leadership, I think we all agree on CEO. Initially, we like to get ourselves involved in each and every meeting, each and everything, okay? And I was working myself crazy 7 days a week initially because I was involved in everything and could never get anything done. Then over the last 2 years, life was a mess because you can't live like that. So I started delegating, promoting the employees, started giving them bonuses based on quarterly. So I have a three-man management team, me, the controller, and the federal programs manager. One person who was there in charge of operation, he's no longer there because he had a personal issues. So those are the 4 management team. And now we talk about where we are, what we want to accomplish this week, and have we accomplished this week, and how are we measuring up us against the quarter.
Do you track your profitability by program, or how do you look at that dispersed operation?
Everything is at a micro level. Even if we have a one project of one person to all the way another project of 20 people, everything is measured at the micro level and it rolls up all the way to the top. Okay? Initially in creating the infrastructure, we spent a lot of money in getting a very nice accounting and general ledger system. Now at least we are outdated there, but we need to go much higher than that. But it allows us at the micro level how many hours an employee worked. And let's say we all consulting an environment, let's say we bill for 80 hours. We know at any particular time how many hours as an employee has worked, how many money we left on the table, why we left it on the table. Everything is at a micro level. Those are the things I spent a lot of time and effort initially to create that infrastructure.
Are there any areas that you're losing money on?
We're not losing money, but the margins are not there.
Okay.
Okay, we're not losing money, but margins, like, we could be losing money on a couple of small things, like, over the year, like XYZ amount, but we make it up easily on the complementing work.
Are the people involved in these projects, especially in different locations, are they paid a straight salary, or is there a commission base?
No. Straight salary. We pay very nicely. I mean, there was a research done, and all of our employees, we do a survey every quarterly how our employees are doing, how the customer views us. The customer as well as the employee say, I like working for Mindleaf because the pay and the benefits are good. Beginning this year, benefits is going to start cutting because we all know the cost of health insurance and everything.
You said that community hospitals and hospices and independent nursing homes are an opportunity. If we were to crystal ball and look in 10 years, I mean, will the community hospitals still exist, or will, given all of the pressures of healthcare? I mean, look, if you look at Massachusetts, New England, and a lot of small independent hospitals have been absorbed by the bigger networks. So I guess my question is, in trying to develop the markets, is this a viable market to really enter?
I really don't know. Okay, I do agree with you. The payment reform and the reimbursement is going down. So 90% of the small to independent hospitals are going to go away, absorbed by the large ones. Community clinics, nobody knows. The doctors who have their own physician practice are now going to become more employees of the hospital because of the ACO and other reasons. Is this the market to go after? I really don't have an answer for that. And that's something which I was struggling, and that's one of the reasons I have my board of advisors, and I'm asking everybody, and maybe, what is the right one? I have no idea.
The challenge is, of course, that the community hospitals will be gobbled up by the larger hospitals. So are larger hospitals also a market that you are trying to penetrate, or?
Yes, I do. I mean, I have tried working, I do work with partners. The problem is, they have vendors, okay, and in order to be the vendor list, it takes you a long time. But the biggest problem is the vendors who have been there, they've been there for such a long time that it's very difficult for them to look at someone differently. I mean, we can look at all the books and everything. Are they providing the same quality, same price, and all those things? But those things answered, are they ready to change the vendors? And that's the biggest problem we are having.
In the market consolidation that is taking place and you're projecting is going to take place, if you thought through the process of is it viable to be a smaller vendor in that marketplace? You know, do you need to look beyond perhaps your own company?
I did look at it, and I think I did talk to a couple of VC firms, just to get an idea. I mean, if you call up the VC firm, they're not going to call you or talk to you. When you meet them at a conference, they will talk to you, okay? So I did talk to a couple of them, and they just said one thing: just concentrate on your stuff only. Don't try to go after the big ones, because if you create a niche for yourself, because, for example, the couple of things we do, whether it's a small hospital or large, they still need it. Okay, so just be in the range of 15 to 20 million and create your own niche.